But we have bottles of water, coffee, and some snacks over there, so help yourselves. First of all, thanks for coming. We're excited to have you all here in person. We want to let you know what we've been up to and how you can all be part of changing the entire healthcare profession. My name is Eileen Kelly. I've been a nurse for 27 years. I received my ADN at University of Pittsburgh in Bradford, so I'm local, and I received my bachelor's at the University of Pittsburgh. I've worked at Warren General when I first started my nursing career in med-surg and ICU. I worked for a while up in Erie at the Cardiovascular Center, and then I've worked for Renal Care of Warren, and most recently DaVita Dialysis as I was the clinical coordinator there. And I'm happy to say I retired last May. So I'm actually done now, but I'm working with this group to continue on the nursing profession. So our concerns for our healthcare system started long ago. We have never stopped advocating for our patients. We're excited to share some information with our community members, coworkers, family, friends, and all of you here tonight. We must work together to pass the Patient Safety Act, it's also called House Bill 106, to improve healthcare in our community. Right now, we have the support of 104 House members out of 200. That's 52% for the Patient Safety Act. If we voted today, we would win and we could pass this legislation into law. However, Kathy Rapp will not let us in to the Healthcare Committee in Harrisburg for a hearing. She does not want this, therefore she will not listen to us. She's only one person, yet she has the capability of locking us out as long as she is in office and remains the chairperson of the Healthcare Committee in Harrisburg. Now, we're going to talk further about this critical policy, but before I go on, I'm going to introduce you to some of our speakers here tonight. We have Shelby Strohmeyer. She has 45 years experience, started as a candy striper and has her RN, and now speaks across the state at various events. We have Dr. Dan Eaton, who's a professor of nursing at Penn State Barrett. He also holds an RN license and still works part-time as a bedside nurse. We have Danelle Corin, who's a hospital RN of 19 years. She's nurse coordinator for the Nurse SEIU Alliance, and she's also a part of the advisory committee for the Department of Health. And we have Tina Siegel, who's a member of the advisory committee of the Department of Health also, and she is an LPN with 37 years experience in long-term care. Tonight, we will be discussing what is the Patient Safety Act, the healthcare crisis and a look over the years, other ways to advocate for our patients, the future of the nursing profession, what we can all do to help now, and how you can help. We will hold all the questions and discussions until the speakers are done, and we're going to try and move through pretty quickly. There's tablets and pens up front if anybody wants to jot down some questions while we're talking so you don't forget. Please, if you didn't, sign the attendance sheet up front and sign one of the papers to put in the door prize box. We have 2 baskets back there that we're going to not raffle off, we're giving them away, and we're going to draw that at 7. And at this point, I'm going to introduce Professor Eaton.
Thank you. All right. Thank you, guys. I'm going to speak to you a little bit about what exactly the Patient Safety Act is, because we're going to be referencing that throughout our conversation tonight. If you want to go ahead and advance the slides here. Go ahead, one more there. So what is the Patient Safety Act? So the Patient Safety Act is legislation that would set safe patient to nurse standards across the state. The number of safe, patients a nurse can care for depends on a lot of factors, though, including what type of care the patient needs, how ill they are, what type of hospital unit they're in. But if we can go ahead and advance one more slide, you can see here from the graph here, it's set depending on the different types of units. So you can see here, the maximum limit on the graph to the right, if you are in, the ICU. Standard of care is 1 nurse to 2 patients. And that would be a maximum. So, well, the standard for the medical surgical unit, and this is, typically where most patients in the hospital are, you would have a nurse to patient ratio no greater than 1:4. So those numbers, though, can go down if the patients are sicker and need more care, more of that nursing care. We can have more staff available, but they can never go up. So this guarantees that patients are always going to have enough professional staff to provide the best care possible and help establish a consistency of care across the state. So whether you or a loved one goes, there's going to be that safe, consistent care across the state and you'll be cared for properly. So this bill also requires transparency and accountability. It includes additional protections for nurses and patients. So hospitals, they would have to publicly report their staffing levels, as well as any discrepancies between what the staffing should be and what it currently is on any given day. Also, staffing plans would be reviewed and adjusted each year by a committee at each hospital that includes bedside staff. So those would be people who understand what patients experience at the facility. And under this bill, nurses are provided with whistleblower protections for speaking out and advocating for their patients. So the Patient Safety Act will also help establish and process, report or instances of unsafe staffing across the state. So now, why is safe staffing such an important issue? Well, we know that it saves lives. Let me say that again. That's very important. It saves lives. So for every patient beyond a safe limit, the risk of death for surgical patients increases by 7%. That's what the research is telling us. PA nurses routinely report having 3 or 4 patients beyond what the research tells us is a safe limit. So if you were a loved one who's in a hospital and has a nurse assigned to you that has that many patients, you're potentially facing an increased risk of death, 20 or 30%. It's amazing. So in fact, if we passed the Patient Safety Act, we could save the lives of 1 in 10 surgical patients in Pennsylvania. As we already discussed, and as many of the nurses are aware, we already know that better staffing has been shown to significantly reduce a whole host of other complications, infections, heart attacks, respiratory, failure to thrive, death, falls, bed sores, injuries, medical errors. Any of you guys watch the news and keeping up with the nurse that worked at Vanderbilt and performed a fatal error? If you look back at that, root cause, staffing. Yes, the nurse made some mistakes. That's a whole separate issue, but it comes back to staffing. As I tell my students all the time, our patients don't just die. They give us signs. And the nurse has to have time, though, to pick up on those signs and symptoms so we can intervene. So better staffing also means more or less readmissions to the hospital. So the bottom line is we could improve the quality of care that patients receive in our state. Who wouldn't want to do that? So safe staffing also fixes the nursing shortage. So that's a pretty common thing we hear. There's a nursing shortage, right? So we've all heard about this nursing shortage and healthcare workers are burning out and they're fleeing the bedside. That's real. If you're a nurse, you've seen it, probably felt it. The community knows it. And we always hear about this nursing shortage. It's nothing new. This has been going on for quite some time. But this is not an issue of not having enough licensed nurses or needing to attract new nurses to the field. In fact, during COVID, enrollment in nursing education programs skyrocketed. So rather, the issue is keeping nurses at the bedside. In Pennsylvania, as many as 50% of new nurses leave the bedside within their first 3 years of practice. That's scary. They go on to advance their degrees. They go on to work in other sectors. But the primary driver of nurses leaving the bedside is burning out because of unsafe staffing. Nurses are burning out and fleeing the bedside because of these unsafe conditions brought about by unsafe staffing. And passing the Patient Safety Act will address the root cause of this. It will bring more nurses and keep more nurses at the bedside. Pennsylvania has and will have more than enough licensed registered nurses. The Pennsylvania Department of Health routinely surveys all RNs and LPNs who are renewing their license. And the most recent survey showed that only 76% of RNs were employed in nursing. 6% were unemployed. So Pennsylvania is projected to have a surplus of 5% of RNs. So that's an extra 8,200 nurses by the year 2030. Pennsylvania is also training and graduating more than enough registered nurses. Enrollment in Pennsylvania nursing programs has increased by 49% since 2003, from 15,651 to 23,278. And it's increased even more, as time continues to go on. People want to be nurses. We want to help people. We just need a system that supports us in helping our patients. So we all know there's a serious problem with nurse retention, nurse burnout, and nurse turnover in Pennsylvania, and it's reached record high levels. In the last 2 to 3 years of this survey, 1,000 bedside nurses, last year, 79% have reported increased turnover since they've started nursing. In California, where they have safe staffing standards, it's been a bill that was signed into law since 2004. More than 100,000 nurses flock to the state to work under these safer conditions. So I know nurses who will only work in California because of safe staffing. Now I know, Representative Rapp likes to seem to use this word California as a scare tactic to appeal to rural voters, and I get it. There's a big difference between California and Warren, PA. There is. But you know what? We also have a lot in common. And we all deserve quality health care. The health care, and specifically the care that nurses should be able to deliver, is the same, regardless of where you live. And whether I live in California or Pennsylvania as a nurse, I want to be able to practice to the fullest extent of my license. I want to be able to protect my patients, and I want to keep nurses working at the bedside where they belong. So go ahead and turn that over to our next speaker now. I'll be back later, don't worry.
Okay, thank you, Dan. Okay, you guys are going to have me just a few more minutes here, and then I'm going to get going with everybody else. That was wonderful information, Dan. Thank you very much. We've been fighting for years for our patients, and many legislators have stood with us while others have ignored us. As nurses, we've been sounding the alarm, advocating across the state, and lifting up policy changes that patients, caregivers, and families in our communities need. During one of our visits to Kathy Rapp's office, she told us to talk to our administrators to work out the issues. We have talked, and we are talked out, and it is now time to try other venues. Far too often, decision makers have refused to listen. Legislators have dragged their feet, and administrators have wrung their hands about the costs. But especially now, frontline nurses, having just led their communities through the most deadly public health crisis in over a century, we know it's dangerous and neglectful to continue tolerating the bare minimum standards, supplies, and staffing mentality that prioritizes profits at the expense of patient care. Legislation for safe nurse-to-patient standards were created back in 2008. For years, it sat on the desk of our legislator collecting dust. In 2018, union nurses with SEIU decided they could not win this fight alone. The only way to get legislators to listen would be to involve many nurses and allies as possible. Nurses of PA was formed out of this grassroots movement. And I'm proud to say that I am now the vice president of the board of directors for Nurses of PA. And I hope to be with them for many years, or at least until we get some safe staffing legislation passed for our profession, our young nurses, our patients. I'm a patient advocate, and I'm going off script here a little bit, but that's in my heart as a nurse. I want everybody to know here. That's one thing you're going to hear about nurses that's most important. We advocate for our patients. My license belongs to me, not for the employer that I work for. It's mine. I'm expected to work under high standards. I'm expected to take care of my patients. I have to speak to the Pennsylvania State Board of Nursing if I don't do things by the proper standards. So it's very, very important to all of us. Since we have met with hundreds of legislators and shared our stories, we've asked for their support to save our patients' lives. We also support nurses who run for office as we need them in there because they understand our concerns and our goals. Kathy Rapp is a legislator we have met with several times. We've delivered over 10,000 petitions to her office at the Capitol on a stretcher. We met with her and shared experiences as nurses. We held a vigil outside of her office to show how many unnecessary deaths we have suffered that could have been avoided. We held press conferences. We had hundreds of nurses call her office. We had over 500 signatures from her own community members that signed petitions supporting safe staffing legislation. Yet, she won't let us in the door at the healthcare committee in Harrisburg. We put up yard signs throughout her district. We sent hundreds of emails. We wrote letters to the editor, and we made appeals in local newspapers across the state, including Warren Times Observer. We put up billboards in her district, yet she continues to ignore the experts. We must keep up the pressure on our legislators. We cannot allow them to continue to make decisions about healthcare without hearing from the experts, the trained and knowledgeable nurses in the medical field. We want to be listened to. The frontline caregivers, the bedside nurses. There are other ways to fight for what we believe will save the lives of many. So now I'm going to turn it over to Shelby, and she will present a little more to you about that. And thank you.
First of all, you see this pile of reports? This is all the reports that Kathy Rapp has gotten that she says she doesn't have. Office of Accountability, 2002, 2012. Supply and demand of nurses. These are all government reports. Economics of safe patient safety. Nursing workforce. First one was done 2001. See how small it is? 2016. This is what's going on. So when she says she's not aware of what's going on, I'm calling her a liar. If I can go up and I can find these reports as chair of a health committee, she has them. Joint state, 2002. See how small it is? 2019. This is what's going on in nursing, and this is what's happening right now, right here as we speak. I'm not a politician. Some of you might know me. I ran for state senate, but that was because I was angry. I had met with so many of our local politicians who refused to listen to us. We even have one politician we call it, he does backdoor run. We go in the front, he runs out back. Yeah, you guys might know. So the Democratic committee asked me to run. This is after I went down to Harrisburg. This is when I went to Lancaster. This is when we've come up here. 8 of us met with Kathy Rapp and Scott Hutchison, and we all sat and cried. We all had the same story, not knowing we had the same story. They gave us the political smile. They took our pictures, as they did the same thing in Harrisburg. And then they shut the door in our face. So when the Democratic committee asked me to run, I had to think about it because we are rural, and I had to think how it would affect my family. And I thought about it. And then as I thought about it, the incident, as I say, about the backdoor run, it was an incident, went to see a senator. While we were standing, there were 4 nurses, myself, 1 from Clarion and 2 from Butler, standing on his front steps. They locked the door, turn off the lights, and go out the back door. This made the media headlines. UPMC administrators wanted to know the names of the nurses involved. And I always made a promise that I would protect every nurse because I was already retired. I was put in retirement after injuries from work. You know, 30 years of pushing and pulling, you can't do much more. So I refused to give a name, and it turned into a verbal battle. After that, nurses started reaching out to me, whether it was by texting or whether it was Facebook. And there'd be times I'd be up till 3 in the morning talking to these nurses. But they told me their stories, and I always promised I would never give their names. Because what people don't realize is there's something called workplace retaliation within the hospital system. And it is brutal. That's how I got hurt. That's how I got injured from workplace retaliation. That's how I ended up with 5 surgeries that now I have to have procedure done every 3 months just to keep my arms moving. And this is what's happening to the older nurses. Because we're no longer nice anymore. We all go into nursing, we want to help somebody. That's all we want to do. We want to help people. Only once you get into it, you realize that's not the game plan. You have administrators who are telling you, you can take care of 10 people and what are you complaining about? Same time, you can work 20 hours. Just put that extra overtime on another day. And then you're going home to take care of your family. I've had 2 nurse friends who have died trying to drive home after one of these long days. One nurse was a visiting nurse. She fell asleep on the way home on a winter day and ran in front of a snowplow. Another nurse hit a tree after a 19-hour shift. We don't talk about any of that. Administrators say nurses won't work. So this is why I got into this. Right now, Pennsylvania. Now, before I got into this, I did the research, as you can see. I wanted to see where Pennsylvania stood, economically, health, and wage. And I cried. I cried for the elderly. I cried for our young families, and I cried for our children. Just because when you put all of this together, I knew that nobody would have adequate health care. I knew what was going on in the hospital setting. I knew by the age of 55, 3/4 of the people I worked with were retired because they could no longer work what administration was saying you were capable of doing. Now you look at these 55-year-old women, those are grandmothers. Can you imagine them, your grandmother lifting a 300-pound patient? Can you imagine your grandmother working 20 hours? Can you imagine your pregnant wife doing the same thing? I myself had twins. I went into premature labor twice. They gave me 2 weeks off and now I had to go back to work. Guess what? It happened again. And this is why we have to start protecting these young nurses and the older nurses. Pennsylvania's number 3 in the nation right now for nursing license. We have 227,000 nursing licenses, but only 129,000 are working. That means, and then during the pandemic, we lost another 20,000 nurses who walked away. Same story. The older nurses are saying, I can't do this anymore. The older nurses have had in the same predicament as hips, knees, shoulder replacements from the 30, 40 years of doing this. And the younger nurses are saying, I have a family. I can't do this. I can't work 100-hour pay periods and go home and see my kid maybe for 10 minutes a day. Younger nurses are opting for higher education. And like Eileen and myself, we're retired and we're not even 60 because you can't do the workload. Administrators are saying you have adequate staffing. What's adequate? Because there's a trickle-down effect when you go into nursing. There's a trickle-down effect where administrators can say, that wasn't my problem. That was her. She didn't do it right. Or he. I say a lot of her because 90% are women. When you look in the healthcare field, it is what it is. And I do not mean to be disrespectful. It's just out of tendency. But why did I run? Because I've been a dedicated nurse for all my life. Started as they called me a paid candy striper at an age of 14, worked in a nursing home 5 days a week. Went on to nursing assistant, the whole schmeal, got my ADN, got my bachelor's degree. I was certified in CCU, certified oncology, the whole schmeal, did it all. And because of my love for the profession, I encourage so many young women to do the same. So now I'm standing up here because these young women are telling me, you lied to me. I have to go for another education because I can't do this anymore. I can't do this anymore. This isn't fair. I'm taking care of acute care patients who should be in ICU and I'm taking care of them on the floor. And this is where we need you guys to come in. Because right now, if you look at it, the way Pennsylvania goes, it is ruled by huge corporate think tank groups. There's the Commonwealth Foundation right across the street from the Capitol building. And there's ALEC and the American Hospital Association. Now, I'd like to think we had really smart politicians, but we don't. These bills are written by these think tanks. These are people with master's, doctor's degree in economics and whatever you want to call it. They write these laws and then our politicians say, hey, we're going to put this in front. And they do, but it's always in favor of the corporate aspect of it. And until we start fighting for the nurses, the corporate will continue to win. You have to remember, we have almost half of the nursing license are not working. If we get safe ratios going, the older nurses can come back. But right now, you can't take a knee replacement and expect them to walk 5 miles. Seriously, I took a pedometer to work, couldn't understand why I was tired. Walked 7 miles that day. Mentioned it to my supervisor and she goes, yeah, that's about right. You can't expect a grandmother to do that. Our bodies can't do that. And you can't expect a pregnant woman to do that. And you can't expect anybody to do that on a regular basis and go home and take care of their parents, their family, whatever you want to call it. So here's what I'm asking right now. Warren County can make history because Kathy will listen to her constituents. We can fight all over the state. You're the ones who vote for her. You're the ones who can put the pressure on her. And this is where we're asking you to help us make history so that we can start saving our patients, so that we can start saving the nurses who want to work, who don't want to leave, but they're leaving because they can't do it, because it's safer to leave because of the legal ramifications that go with it. And it's safer to fight against these politicians who don't even know what they're talking about. But they will go with the think tanks. They will go with corporate. Been there, done it. I mean, I dealt with the administrators from UPMC trying to find out who the nurses were. If those would have been UPM nurses, they would have been destroyed. So this is where I got into politics. I'm not a politician. I'm an advocate. I'm a loudmouth little nurse. That's who I am. And I'll always be. But I love nursing. I love my patients. And I have seen some of the most amazing things, and I've seen the most ugly things you can ever imagine. But at this point, nurses are educators, nurses are teachers, nurses defend you. We need you to defend us. We can't do this on our own. And please take some signs, please help us, because the best way we can do this right now is through word of mouth. And Kathy, the idea of one person in a little rural area controlling such a major issue is unbelievable. And I know a lot of people don't understand that. But as a community and as her constituents, help us. And that's what we're asking, and that's why we're here today.
Told you I'd be back. So I want to talk a little bit about how we can build a stronger future for our patients, our communities, and our profession. So, I'm a registered nurse from Northwestern Pennsylvania. And when I got introduced, I'm a full-time nursing professor, but I still work at the bedside. My specialty focus is mental health. Work a lot in the community too, but I've had a variety of different experiences in the hospital, different units. And I've gotten to see a lot. There isn't a setting that I've experienced that hasn't been touched by the importance of safe staffing. So, my wife's a nurse, come from a nursing family, and I really want to make nursing a profession that my children would want to enter, that I'd be comfortable sending them out into. And nothing hurts me more when my students, after they graduate, they call me 6 months later crying, they're thinking about switching jobs. It's not a specific unit. It's not a specific hospital. This is a problem that exists throughout the state and throughout the nation, and we have the power to change that here in Pennsylvania. So as a nurse educator and researcher and clinician, I've been lucky, and I've had to work in a variety of different settings and get a lot of different experiences. And as a professor, I've been to many different units in hospitals, and I can tell you again that safe staffing is important in every facility, every specialty, and for every nurse. It's important for every member of the community. I truly mean every nurse. I truly mean everybody. I haven't met a nurse that doesn't say staffing isn't an important concern to them. At least if they work at a bedside. The bedside, maybe if they're an administrator, it's still an important issue. But, we need safe staffing to protect our patients and our profession. And it hurts me when I talk with my current and former students and they tell me that they either have no intention of working at the bedside because of what they've seen, or stay at the bedside for long periods of time. A number of students contact me after their first year and say, hey, Dan, will you write me a letter of recommendation so I could go back to NP school? There's not a shortage of nurse practitioners. There's a shortage of nurses willing to work at the bedside. And why is that? We said the number one reason is staffing. Nurses always say they don't think they can do it all, or provide that quality of care to patients with the current staffing levels. And you can't. Things are going to get missed. People are getting hurt. I'll often, keep in contact with my current and former students, and they always hit on staffing. Chronic short staffing is dangerous to patients. It's dangerous to the nurse. And it can be part of a number of complications like we've talked about earlier. So, how often are students returning to the classroom saying nursing is not what they imagined it to be? Unfortunately, far too many. People don't understand what it is like to be a bedside nurse. And that's why it's important that we tell our politicians. That's why it's important that they listen to us. So I'm lucky, I get to work with the best and brightest students, and I truly mean that. Not everybody can be a nurse. And it takes tremendous aptitude, dedication. It doesn't take my students very long to see the importance of safe staffing. Students will see negative outcomes. And then when we do the root cause analysis, we always arrive back at the same point. How could safe staffing help? How could staffing improve the patient outcomes? And that's a really important issue. And it's nice that my students can see that. But they also see nurses fleeing the bedside and wonder, do I want to be a part of this? And I always encourage them, yes, you do. You want to be a part of it. And you want to be part of the solution because we can work together and we can change this. It takes a lot of work on my end to positively reframe things that have been seen or heard throughout the communities. But we can. It really hurts me when one of my brightest students says, maybe I'd rather just be a bartender. Yeah, I'll make more money, and I won't have the level of burnout or stress. That's really hurtful. That's really sad. We should not be having intelligent students say, I'd rather be a bartender. Nothing against bartenders. The world needs them too. But, we need bedside nurses. Nurse turnover rates are highly variable. However, there's a significant turnover at the bedside. And there's a problem when I'm on the unit and the charge nurse has less than 5 years of experience and less than 2 on that unit. That's a big problem. The problem when I see one registered nurse on the unit with 30 patients, that's a huge problem. That was me. I see this, and my students see this. I have to, have a number of students who have no desire to work at the bedside, even immediately after school, to get that training, and that's really sad. The lack of safe staffing standards are impacting the profession, and we have an even greater, and it's going to continue to have an even greater impact in the future. But like I said, we don't have a shortage of nurses, but rather a shortage of nurses willing to put themselves in that environment. And it's especially concerning as the demographics of our country continue to shift. Can Pennsylvania be a leader in something for a change? We wonder why we're losing population. We just lost a congressional seat. Can we step up and lead for once? Many nurses are getting older and leave the profession far too early. I'm not that old, and a lot of my friends that started practicing when I did, they're leaving the profession. I see and talk to so many nurses who are upset, and they cry in the break room or in the car ride home, as Shelby was saying. They're frustrated because they can only do so much. And what we need is more staff. And I ask myself, is this a profession I want my children to enter? There's a lot of work that needs to be done, and it starts with passing the Patient Safety Act. How will the Patient Safety Act change the future of the nursing profession? Well, the Patient Safety Act will change the future of bedside nursing because it will keep more nurses at the bedside instead of this vicious circle that we are in. The research is clear as to the benefits of safe staffing, and unsafe staffing leads to many missed care opportunities and poor patient outcomes. Safe staffing can have a tremendous impact. And in many cases, especially, in smaller rural hospitals whose administrators seem to be against the safe staffing for some, odd reason, it really wouldn't take that much. One more nurse on the unit. I mean, these, rural hospitals don't have huge, tremendous, units. It wouldn't take that much for this to happen. And it could make the biggest difference in people's lives, in our communities' lives. It will allow patients to have safe care in the communities that they live, rather than so many patients leaving the rural settings. You should be comfortable and confident having good care in the community that you live, rather than having to drive to Erie, drive to Pittsburgh, drive to Cleveland, Buffalo, wherever. These are our community resources. These are our community assets. These are our nonprofits. They're our community, and that one person doesn't run them. Safe care should be a right, not a luxury. So the Patient Safety Act will allow nurses to provide better care for all patients and have better outcomes. It will allow nurses to practice to the fullest extent of our license. What's, my advice to people who want to become a nurse and to those who are, newer nurses? We have to advocate. We have to advocate beyond the four walls of the hospital. One thing I always ask my students, what's the most important job of being a nurse? Safety. We have to create a safe environment for our patients. It's pretty hard to do with unsafe staffing. And advocacy. We have to advocate for our patients and stand up for what is right. And that's why I'm here. I'm here to stand up for the patients, for our communities. And, I mentioned earlier, would this be a profession that I encourage my students to enter, or my children to enter? Yes, I would love my children to be my students someday. I'm very happy with the profession I've chosen, the lives that I've impacted. There's a lot of good that happens in healthcare too. So I answer yes because I'm hopeful for the future. I'm hopeful for our profession, and I believe that it's not a question of if, it's a question of when the Patient Safety Act and legislation that is similar will be enacted. We have to have this happen. It will happen. There's really no other way. Healthcare is at a breaking point. It's clear that we need legislation to solve this problem because this is nothing new. Hospitals cannot tackle this issue without legislation because they haven't. We have to have legislation that has teeth. Otherwise, we'll continue down the status quo. Who is happy with healthcare? Who is happy with the quality of care that they receive in the hospitals? It's been a problem for some time now, and it's worsened. Technology, the pandemic, everything has caused us to progress. The pandemic has really caused us to progress at lightning speed. So nurses, we represent the largest segment of healthcare professionals. And we also represent a large segment of the voting population. About 1 every 45 voters is a nurse, and we turn out too. So safe staffing is a nonpartisan issue. The Patient Safety Act has bipartisan support. For the life of me, I can't understand why every legislator would support this. Maybe they're listening to hospital CEOs. Oh, well, we can't afford it. It'll shut our small rural hospital. I think those are lies. And if that is the truth, then guess what? It's that board of directors, it's that hospital CEO's job to go out and advocate for changes in funding, just like I'm here advocating for my patients. Do your job just like I'm doing mine. We will not take the continued action of legislators. Don't we live in a democracy? It's a democratic republic. I believe in our democratic republic. And I also believe in the resolve of nurses. Laws are changed and enacted every day, all the time. Medical errors, they continue to be a leading cause of death in our society. That's a problem. About 18% of our gross domestic product is spent on healthcare, and our outcomes rank in the middle of the pack. Nurses have the power to impact that and change that. And the good thing is, it won't cost a lot of money. We always like to talk about money, how there's not a lot of money. And I saw a recent flyer that the local representative put out about how they're solving the problem, putting money at it. Amazingly, we found money. So there is money there. It's just a question of how we want to use it and how we want to allocate it, and do we want to allocate it for nursing? And I believe we can. Medical errors, big problem, got to correct that. Healthcare organizations cut corners by understaffing and continuing to put profits over patients. But the interesting thing is, we hear about, do you want more overreach of government, involvement, the big bad boogeyman of government coming in and controlling more. And, it's nothing new. There's regulation in all sorts of industries. Truck drivers, how many hours can you drive on the road? Autopilots, thank God we have that legislation. Daycare. There's legislation for how many, staffing in daycare units, thankfully, because that's a good thing. So, why can a nurse work 12 hours with no breaks and be short-staffed? They shouldn't be able to, but we can work together to change this. The power is in our hands to change things. I always ask my student, what's the most important job of the nurse? And the answer is always safety and advocacy. The care and advocacy we provide our patients does not end at the bedside, and our advocacy must continue beyond the four walls of the hospital. And we won't stop until we can protect our patients, our communities, and our profession. Public opinion is on our side. And like I said, this legislation has bipartisan support. But some legislators seem to want to take the path of least resistance, and rather than standing with nurses, are either choosing to take no action or side with hospital administrators. And what I'm curious to know is, what's the solution? Where do we go? We cannot continue going down the same path that we are. So on the surface, you may hear reasons as to why safe legislation cannot be passed, but once we discussed it, and we get into the research of it, and we talk about the nuts and bolts of it, it's really, how can't safe staffing legislation be enacted? A lot of the, the information that you see maybe in opposition against this bill is nothing more than cheap talking points, and it's not backed by any research. My advice to people who want to become a nurse is to do it, but to do it for the right reasons. It's a great profession, and we are working to make it better. So for new nurses, or even nurses who are feeling burned out or maybe left the bedside, my message is to persist, to continue to fight and stand up, get involved, share your story, and advocate to the number of reasons why we need safe staffing legislation. Together, we continue down this road. We will get this legislation passed. Let's just do it sooner rather than later, before more nurses leave the bedside, before more people get hurt. Let's protect our patients from needless injury. Let's stand up and get this passed now. And I believe we all wake up every morning with the best intentions, right? Like I wake up, I want to be the best dad I can be. I want to be the best husband. I think our politicians wake up and hopefully they want to be the best they can be. They want to work for their communities and they want to support them. Let's educate them and get them to support this legislation and understand why this is such a benefit to the communities, why we need this, and come up with solutions rather than roadblocks. One person should not be able to control hearings on this legislation. That's not the democracy I want to live in, so let's stand up and change it. And I will turn this over to Danelle.
Hi, everybody. How you doing? Thanks for coming out tonight. I really appreciate you all coming out. It's really important to us that we get the word out about what we've been talking about now. So my name is Danelle, and I've been a nurse for 19 years. I have worked in a lot of different capacities as a nurse. I've done med-surg ortho. I've worked in the emergency department. I was on the IV team, so I was the person that you would call if you are a tough sticker with roly-poly veins. I also worked on oncology and telemetry, and most recently worked in the COVID units up until about 6 months ago when I transitioned out of the bedside and went to a same-day surgery capacity. So I'm going to kind of back things up a little bit and talk about some of the things that we've done to help start our advocacy. I worked with 10 nurses as well, obviously, as well as myself, and we kind of banded together with a goal to start having discussions with the Department of Health to try and forge some real change and see about getting regulations that would guide us to the things that we really needed. So when we first began, we really didn't know if we would even be able to get conversation with the Secretary of Health. We did not expect to really get much headway, but we gave it a go. We wrote letters, we made phone calls. I think we made like something like 600 letters put out to the Secretary of Health in order to try and get a meeting with her. We were able to do that, and in that space, she listened and heard us, and she listened to our stories, and we had a really great back and forth conversation that led us to a place where we were invited to start having meetings monthly with the Department of Health. Which is a huge space for regulatory guidance as to how we should be practicing safely. We were looking for things that you would think would be supplied to us as healthcare workers, like proper PPE. What that means is your protective equipment. So the masks that you wear, the headgear that you wear, the gowns that you cover yourself with, your shoe covers if you need them. These things were not necessarily given to us, which is wildly unacceptable in our profession. We have to be able to protect ourselves in order to protect our patients. So once again, we were invited on a monthly basis to meet with the Department of Health. And one of our biggest successes and wins, as far as I'm concerned, was having a voice at the table to have regulations set where we could say what PPE we needed, when it was compromised or dirty, because that was actually an issue. We were wearing masks, coverings, you name it, for sometimes weeks at a time, multiple uses. And these were things in Nursing 101 that I learned, you use one time and discard it immediately. We were literally putting them in paper bags, these magic paper bags that were to keep them clean and to make them reusable, which we all just collectively across the healthcare continuum scratched our heads and were like, what are we doing? This is not proper at all. So we were able to actually have regulation that said, hey, I'm allowed to say that this is dirty and I'm going to actually get something clean now without having a place where we could get in trouble for it. I was actually at one point in my workplace pulling a mask and counting it like it was a narcotic medication. It was the most wild thing. One of the most wild things I've ever had to do as a nurse. I could not believe I had to do this. So we were able to, start having great discussions with the Department of Health and forge some serious change. Also, one of the bigger things that we have done, which was a huge thing, was to work in the nursing home or long-term care space. We talked a lot about the Patient Safety Act. Part of our advocacy was also in the nursing home space. Now, that regulation or the way that they do the care for nursing homes is very different than hospitals. Their regulations are based on what we call PPD, that's hours per patient per day. This regulation has not been changed for, I believe it's like over 30 years. So these folks who reside in long-term care facilities and need day-to-day care from nursing assistants, LPNs and RNs, physical therapy, occupational therapy, things like that, they are allotted, were allotted 2.7 hours per patient per day. So if your mom, dad, brother, sister, whoever is in a long-term care facility, they get 2.7 hours per day. So I want to break that down for you because we run in shifts. So you have 3 shifts in a day. If you look at that by shift and you really break that down, that's 0.9 hours per shift. That's less than 60 minutes. The amount of care that a person needs is going to exceed that. I can speak to that 100%. If you think about the medications they need to have, the wound care, the treatments, the getting them up and out of bed for breakfast, lunch, dinner, making sure that they are properly clothed. These things take time. If you think about it just in the, how you would think about what you have to do for your young children. I have 3 kids, very busy person. Those things take time. How long does it take for you to get your kids up and ready to get out the door? My gosh, sometimes I set an hour aside just to do that. We're talking about taking care of our elderly population and having them live in a dignified, respectful way. And that time is being snatched from them and they're not able to be cared for. So we advocated very, very hard to increase that. And we were told at the very beginning, you are not going to see this happen. This is not going to happen. There's no way. So we didn't really hear that very well because we're very stubborn. And we kept on advocating and we kept on just pounding it into these folks that we really need this to happen. This is so important. And eventually they started to listen. And we ended up being able to change that from 2.7 hours to 4.1 hours per patient per day. That's huge. Is it perfect? No. But it is all but nearly doubled over from what we once had. We're not quite done in that space yet, though, because there is money that has to be allocated there to make those hours translate and actually happen. We want to assure that money actually goes to where it needs to go, which is the bedside, the people who are actually there taking care of your mom, your dad, your brother, your sister. We want to make sure that it goes to the people who aren't sitting in offices pushing paperwork and ensuring that they're making money. We need the people who are at the bedside getting ready to brush your mom's teeth or do her nails or make sure her hair's combed, to have that money be allocated to those people who are doing that hard work to make sure that your families are well cared for towards the end of their lives. So we're still working on that. And we need you guys to make sure that you pay attention and really, like, when we need to finally, like, do those final acts on that too, that you're involved too, because it could be your family that needs that care. So like I said, one of the biggest things that we've accomplished was being able to work with the Department of Health and making and really demanding that we have a seat, because for a long time, you know, so many decisions for healthcare have been made by people who don't do healthcare. They really have no place making these types of decisions for us. They don't have the first clue of how to deliver patient care or what it's like to, you know, be with someone's family member who is in terrible pain or needing support or guidance or teaching. They don't understand what it takes to care for a person, not just physically, but literally that whole person. Because it's not just physically taking care of people. You have to emotionally take care of people too. So we came up with a nurse platform in this space. And when we talk to the Department of Health, we have like significant goals in mind, and most of them we were able to do. We wanted meaningful investments to expand and stockpile our protective equipment so that we can be safely protected when we care for patients, because it was obvious that we did not have that. So now we need to have it, and it's now regulated. We wanted to be able to do rapid testing of people for COVID. We also wanted to have paid sick time for every essential worker, so that we could assure that people who were sick were able to stay home, instead of like moving this disease through the workforce and then not having staff to care for people. Like I said, we were successful with most of these things. And like I said, one of the things that we were most proud of was being able to say, hey, this stuff is dirty. I'm going to get myself some new stuff, which is terrible and great all at the same time. We still have a lot of work to do to implement our fight for safe staffing and for our nursing home sector. And we really can't stop our momentum. We need that word of mouth from you all to start talking about this with your families and your friends, and just know that, you know, if you are faced with being in a hospital or a long-term care facility, your nurses, your staff that is working with you, they want to work with you and they want to take care of you, and they want to take care of you just like I want to take care of my family. That's how I've always practiced. And that's why we stand here and we advocate, because that's been taken from us. So at that end, I'm going to go sit down with my friends and we're going to have a little chit chat. We want to, we want you guys to ask us questions. What questions do you have? And we'll happily answer as best as we can.
Okay, thank you all for coming. While I do my last little piece here, they're going to draw the tickets for the door prizes. Okay. And we're going to have some questions at the end after that. We're going to get through this real quickly. My name is Tina. Like I said, I'm an LPN and I've worked in long-term care for the last 37 years. So you might say, why is she working in long-term care here advocating for the Patient Safety Act? Well, it's the same as Danelle said. We've all been working together as nurses because we're doing the same thing in long-term care as we are in hospitals. So the more voices we have putting that out there, the better chance that we are going to have to be able to make a difference. So that's why I'm here. And the things that we're going to ask of you guys out there is to help us pass the Patient Safety Act and improve care in our communities. Is first, we need everybody to contact their local legislators and talk to them. because they're the ones that's going to make this happen. We're asking everybody to email your state representative and senator and ask them to take action. We need you, their constituents, as a community member and voter, to let them know that you are concerned about the direction of healthcare and ask them to do everything in their power to pass the Safe Patient Safety Act. Now, we can't continue to allow the decision makers to sit back while patients are suffering. So how can we spread the word? If you're part of a local community network or organizations that you are connected to, can share that we can share this presentation with to get the word out there to everybody. What local decision makers do you think could we reach out and ask for their support? And can you connect us with others in your network? Like I said, we must work together to protect our patients and our families and our neighbors who are also going to be in the hospital. And we're all in this together. So I want to thank you all for coming out tonight. And like we said, we're here if anybody has any further questions or just want to mingle and talk, we're going to be here for that. And then have you drawn you have the names for the first one is Karen Black.
Choose, Gary.
Your choice. Second one is Dawn Pharmacy. Whichever fast she doesn't choose.
When she gets the one she wants and I get what's left.
Right.
Story of my life. I'm looking for it, you
You know, I'd like to say something. When we were showing the numbers, I was very active with the Nurses of Pennsylvania for a couple of years, and I kept looking at these numbers, like, why do they look familiar? When I worked oncology in the late 90s, the early 2000s, those were the acuity numbers that we worked with then. So these numbers are not new. These are numbers that we have had, and we're just asking that, and that was rough work then. But those numbers are not, they're not something that was just pulled out. We actually, when I was charge nurse of oncology, that's how I figured out my staff, with those exact numbers. Now, I think it might have been coincidental, and I just kept looking at, going, why does that look familiar? And then it just, one day it was like, oh my gosh, that's how we got our nurses and our nursing assistants and our LPNs on the floors, by those numbers, exact numbers.
The things that we are needing, asking for, are basics. And they are putting such a burden on the healthcare system that we need. Would not actually put a burden on corporations. Yes. They're putting, so, I mean, these are billion-dollar corporations. And it's like not a sweat for them to give them to us to provide these basics, but it all comes down to greed, corporate greed.
And you have to remember too, during the bill that went through, it was called Nursing Bill
124, 125, where it was already said then that nurses would never make any money. They were only allowed to have a 1% raise over 3 years. So when they throw up the numbers of nurses making too much money, that bill is still enacted at the federal level. It is. So the stuff, I mean, they're making nurses sound horrible. You have to remember, some of these high-end doctors down in the bigger cities, they get paid annual retainer fees of over $1 million. They still get their own office fees, but this is what the hospitals are paying them just to stay within their system. CEOs are getting paid multi-million dollars annually. So we're asking for 1 or 2 more nurses on the floor.
And it goes back to something you said earlier about how it's predominantly a woman's job.
What I was told, and the only reason I know those facts is I went to one of the best orthopedic surgeons in Pittsburgh, in this area, and my brain could not comprehend why I was breaking. I was still barely 50. And he was honest. He goes, your generation, you're breaking. You guys are all nurses. I see more nurses than I see construction workers because your bodies are not made to do this kind of work that they are saying you are responsible for doing. Now, as a result of those injuries, you got nurses going to work in pain. You got nurses going to work who should not be there. And that's why I'm not working. Trying to take care of these acutely ill patients. And it's a problem. You know, we're not, and the younger nurses, they're like, I'm done. I'm young enough, I can go back to college. And they do. We have to, right.
Did you have a question there, Kim?
Yep, I don't have a question, but a quick comment and then an offer I'd like to make, since all of you have already heard my name. If any of you decide to go on Facebook after you get home, I would not mind correct attribution for what I'm saying. The comment is that the YMCA has lost a whole bunch of points, in my estimation, for bailing out on hosting this event. I know it claims to be a community service organization, but if it's not going to be a community service organization, it needs to shut up about pretending to be one. The second thing is the offer. And did it cost anything to have this event here?
Yeah.
Okay, I want to make a donation toward that. In fact, I'd like to suggest that the rest of us do too. And that's because sooner or later, I'm going to need the services of some, probably all of these people on the panel. And it's obvious from your comment that the executives in the suits that run hospitals aren't really going to care that much about what kind of service I get. It's also obvious that Kathy Rapp doesn't give a rat's, well, you know, about what kind of healthcare I get. And that's particularly significant since she has her healthcare already guaranteed and is probably the best on the planet. So why should she care how good my healthcare is? So anyway, who do I give this to? In fact, why don't you pass the hat and see if anybody else might.
Amber, is it okay to take your name?
It will be donated.
Yep.
Yep.
Anybody else, please feel free.
It goes to funding, like.
Well, thank you guys. It shows that the community does support nurses and
Thank
is sure
you.
to appreciate that and anything. I mean, I know not everybody is in a position to give financially, even, you know, anything helps, any support we really do.
When you're supporting, just think, if you notice, you're not going to see a bunch of young nurses here because those are the women who are, a lot of them are primary wage makers. But the retaliation, you have to be careful because they find a reason to get your butt down to Harrisburg to the Board of Nursing. And that can cost you a lot. Not to mention emotionally, physically, and your license and what it does to your family. So that's why you don't, so have I been there. That's how I ended up getting with the nurses of Pennsylvania. I was injured at work and they accused me of something and I fought it. Thanks to SEIU, they snaked my hide and I cleared my name 100%. But this, I was talking to a nurse who's fighting it right now, and she's been fighting for 5 years to save her license. She says they now do it 200 nurses at a time in Pennsylvania. So the nurses are afraid to speak because, you know, when we're talking about hospital retaliation, you think you understand it until you're under the light and it's horrible. So when you're looking and you're seeing, thinking maybe the young nurses aren't involved, we're up here because we can do it. They can't touch us. And we can protect those nurses who they might be working in the background, but it's not safe for them to be up here talking.
Did you have a question?
Yeah, I wanted to say something about corporations. And they're big ones. Looking around online, you can discover Kathy Rapp's funding. It's pretty easy to do. And there's an amazing amount of corporate money that goes into her. In fact, if she were to stiff the corporations, she'd be out of a job. She knows it. We all know it. So what do you do about corporations? Well, there's something that was invented a long time ago called the boycott. You can advocate. You can call somebody in the public relations division of a corporation, say Health and Hospitals, your insurance company. I'm going to switch my insurance unless you back this bill. And you can talk to my lawyer. I mean, you can get pretty tough with them. Notwithstanding, they're paid to listen to people mouth off about various things. But the thing with corporations is that they are robots. They're only interested in profit for their shareholders, not for the people who work for them, not anybody else, you know, the people that buy their services. It's like their bottom line. So if somehow you can get across to a corporation simply by repetitive action, that they could lose money. They could definitely lose money, and they could lose market share. If they don't pay attention to what people actually want, you'd be surprised. I think there could be some activity there. So think about it. Look around online. See who funds Kathy Rapp. And so just the people that are on the books, a lot of local citizens here in Warren who gave her a couple of bucks, and that is public information. You could find it. So maybe you want to talk to them a little bit. I wouldn't twist their arm, but a corporation you can be pretty tough on. So that's my thought.
I'd like to know what she's afraid of. But I mean, they can't, yeah, she's afraid of losing her job. That's
Not
why,
being able to name her successor.
right. You know, she knows that we're here to tell the truth and to prove that some of the things that she put out in her newsletter and her online speech that she did weren't true. You know, we're the frontline nurses who see what's going on every day. And she got highly upset with the signs that were in her yard. That's because it's the people in the local community who vote for her are actually seeing the truth now and seeing, you know, that some of the things that she was saying aren't the truth. And it went to the point where they, you know, we had it all set up, the town hall. It's a YMCA, and it got canceled because of these people with the big money, you know.
2 days ago.
Yeah, 2 days ago.
2 days ago. Let's talk about the letter she put out, what, 5 days ago?
Yeah.
She didn't want us talking.
Did you have a question?
Yes, I work in a small local hospital, and management came down and said that we would need 25 new nurses to cover the shifts and everything, and they said they can't afford that, and that it would close the door
They're saying that to a lot of them.
and stuff, and I don't know, I've worked there for 28 years, you know, and I've seen, right now, we're so short-staffed because they can't find anybody. We have so many travelers and stuff because they can't find any people that want to work. And it's like, if this passes and they have to hire 25 more people, where are they going to come from?
You have to realize a lot of nurses are not. Over almost 100,000 nurses in Pennsylvania are not working. They have left because it's dangerous. And a lot of nurses have gone to travelers, but you know why they have? I've spoken to them. When you sign a contract, you're guaranteed a wage. You're guaranteed an assignment. You're guaranteed the hours you're gonna work. When that hospital goes against that, now they're breach of contract. Those nurses are safer being under a contract. My daughter-in-law to be, she's a contract nurse. She works locally. It's safer. Our license, we work really hard for those licenses. I mean, and it costs us almost $200 when we renew them. But if you can't physically do the job that administration is saying you have to do, if you can't take care of that 10, 15 patients, If you can't lift those, let's be honest, our patients are getting sicker and they're getting bigger. If you can't lift them, then you cannot work, and you're endangering them and you're endangering your license. So it's safer for them to walk away.
And I really believe it's like a, a circular argument, what came first, the chicken or the egg? So we have short staffing because we don't have enough nurses, but we don't have enough nurses to fix that staffing because they're not willing to work in that environment. So if you break the chain with legislation, then, I mean, the nurses are there and they would be willing to work if they knew they could work in an environment where they felt supported, protected, and safe. And in terms of the money and the financial things, that's one of the biggest talking points. But it's amazing how much money we found, during the pandemic to just blanketly give to hospitals. And what we're asking for is that money to be appropriately allocated for nursing services and used appropriately. And, I think that's a discussion that we can have. If Representative Rapp is entitled to her opinion, I would say everybody's entitled to your opinion, even if it's wrong, right? But you can't obstruct progress and can't obstruct legislation. That's why the first step, we want to at least have a hearing. Let's talk about it. Where do we go from here? How can we work to get safe staffing legislation passed? If rural hospitals are worried about the funding, what can we do to make sure that that's not a concern? So.
And let me ask, you've been there. What do you get when you get pension? I had a pension.
I do too.
They took them away. They don't need to. They don't need to have it.
I do have a 401k.
And you can any. So, I wasn't in, and it's I would get higher. No, that's mission. Right. You could have sent 2 people home. They were, you know what? I'm not doing that. I have been on both sides. And I really, I don't work. I work on this. It started, I was, it started in, I was, so you can see your accounting, what they pay, what they're out, and and we got this bill. Can you speak up with one people over there? Oh, I'm sorry, so we get this bill in that. When California has got this bill in that, it said nurses moved. I mean, oh, hey, look at that, they've staffed. I can deal with that. No. Okay, it doesn't have that, so we can't say that. Oh, maybe people will come back and more will come in.
Did you have a question?
Yeah.
I just kind of want to follow up a little bit. Like you said, work many nights. To your point about our rural hospital, is there anything in the bill that allows kind of consideration if a hospital has a problem finding staff? Now, I know there's a lot of funders out there who might not transfer into rural areas, issues that keep staff levels there. Is there anything that's consideration to the hospital?
Now, if I remember right, there is a stipulation in the bill that gives a time frame. It's not like, okay, tomorrow you have to have these numbers. You know, it's a workable thing. They made it so that you have to attempt to do it if there, and you have, the hospital has to show documentation that you have attempted to do this. You know, it's kind of like the same thing as most of the nurses know, the mandatory nursing issue. You know, they can't mandatory you unless they have tried, and they have to show documentation they have tried to find, or they are fine. And it kind of works the same way as that. So it's not one of those deals where, okay, it goes through tomorrow, and then in 3 months you have to have those numbers. It's, they give them time to see who's going to come out. But then there again, you got to remember, Pennsylvania is number 3 in the nation for nursing homes. Those nurses are there. You got to make them feel safe enough that it's safe, that it's worth coming back to. It's
I would
worth.
go back.
I would too.
I won't
If
now.
I could get into a job where I didn't have to lift the heavy patients, I'd go back in a minute. You know, I started in the 70s, you know, and just continued. I have recommended it to so many people. Most of the nurses feel the same way, but it comes to a point, is this safe for me and my family, and is this safe for the patients? What do I do if I hurt somebody? Because once you've hurt somebody, you never take that feeling away.
And I hear what you're saying. How do you attract rural or, you know, people to work in rural areas? You know, and like the same argument is made for physician. Physician recruitment is absolutely huge. And, you know, let's face it, where would the, you know, the big shot orthopedic surgeon want to work? You know, sunny Florida or, you know, yeah, you know, so, but there are orthopedic surgeons that do work in this area, obviously, and they have very good ones, you know. So same thing can be said for nurses. You know, the good thing is with nurses, we work cheap. It doesn't take very much to make a nurse happy. You know, the running joke is pizza parties and things like that. But I mean, I think it's really the little things that would really make a nurse feel valued. And I know a number of nurses that, you know, really leave and go to bigger cities, bigger hospitals, because, again, of safer working environments and safer working conditions. So by creating a culture of safety, I think, you know, smaller hospitals will, you know, be able to attract and retain, you know, more staff. But yeah, I think it's a conversation that can continue.
In the interest of
Go ahead,
time. Oh, sorry.
She's been trying to ask.
I heard someone mention hospitals being corporations and the people at the top making a lot of money. And I'm wondering if there's been any studies work going into changing the culture to bring nurses up, to have some parity in any way that nurses will have more say in what happens in this culture. How do we change the culture of the corporation to make nursing a more important aspect of the whole process? That, yeah, it's important to have safe, it's important to have safe staffing, but there's so many other issues beyond that. This is, to me, just the tip of the iceberg, so to speak. And is there a time and a place we want to put our energies into exploring that and really get a grassroots push that may spread around the country to actually change the culture? Because I don't think changing one little aspect is going to right the problems, the issues for nursing.
Now, I can remember back in, I think, 1981. Yeah, that's a long time ago. When the insurance companies came through and decided, okay, we're getting rid of team nursing and we're going to primary. You're getting rid, everybody, all the LPNs, all the nursing assistants have to go, and we will hire a few RNs. This is when this started. I can remember as a nursing assistant back then, I was just out of high school. I was responsible for training these new grad nurses. And I was so angry, I asked an administrator, and his reply was, we are now a business. The patients are no longer primary. You do whatever you can. If you have to hide a bedpan under the bed, then you do it. Literally, that's what he said. And that's the culture we've been living in since that period of time.
It's not for lack of trying. I will say I'll try to address this as best as I can. I think, you know, across the United States as a whole, you know, the nursing profession is arguably and has been proven to be one of the most trusted professions, period. And one that people go to for, you their needs and concerns and know that they can get a trusted response, right? And a honest response. It is not, it's not for lack of trying. Healthcare has become a broken system that has been profit driven for a long time. And that culture is at this point is almost unable to be fixed and broke that cycle broken without law. We have screamed to the rooftops for just safe staffing to be able to care for people, to prevent infections, having people have sentinel events that not catching somebody who is having a heart attack. Like these are the things that we have talked about. We've had these hard conversations with our highest administrative bodies. They are unwilling in these huge corporations to give the staff needed to appropriately care for people and to make that culture appropriate, so that we can care for people, because it ultimately does affect their bottom line. Does it affect it to the point that they go broke? Absolutely not. But it may affect their bonus at the end of the year. And that's the unfortunate piece of this, is that we have tried, we have gone to great lengths, and at this point it is law that we have to be driven by. And it has to be pushed. Like, as you can see, for 30 years, we've been running on the same patient hours per day when these people are sicker and require so much more care. And this should have been a no-brainer for our state to do that. And they did not, because it ultimately affects a bottom line. That is, I think, the nicest way I can say it, without being really unprofessional. But we do try. I mean, we've tried to do the nice way and to do the respectable way to deal with things, and it just has not worked. And trying to change a culture at this point is going to have to be done by law. And that's what we had to do to stop mandatory overtime, to be pointed at and say, hey, you're staying tonight and you have 2 young children at home. I came in right as those laws were being passed. I became a nurse in that time period. I had one of the first contracts in the state that said before the overtime laws were passed. And I was fortunate enough to not have that experience until COVID. And then they did mandate. And that feeling was awful to have to do that. So, I mean, these things, even though it seems like a no-brainer that we shouldn't mandate a nurse to take care of somebody after 12 or 16 hours, they're exhausted and should not be responsible for that. That should be a no-brainer. But it didn't translate. I mean, it's a systemic problem.
You do realize that you just suggested something that we liberals are constantly called dirty commies who hate America for.
The sad part is, even before mandatory nursing, I worked 100-hour pay periods every 2 weeks. I couldn't tell you what my base wage was. When I worked the 3 to 11 into night shift, the only time I saw my kids is to yell at them for something they didn't do the night before, because I wasn't there as a mother. So when they came up with the mandatory, where they had to prove they couldn't find anybody and you had the right to refuse without jeopardizing your job or being charged with abandonment of your patient, it was a big deal.
So in the interest of time, I don't want to keep anybody from being with their families this evening. We do invite you guys to come up and talk to us individually, and we'll do our best to answer the tough questions. And we also invite you guys to take the literature we have. If you want yard signs, please take some yard signs, get this word out, and try to support us in our ultimate goal, which is to provide safe care across the Commonwealth.
If I may, I apologize for taking more time than I should. I'm old enough now that I'm starting to try to get rid of the stuff in my life